My name is Bradley Shaw. I'm a licensed professional counselor. I work for the Baptist Health Behavioral Services Clinic located in Southwest Little Rock. I grew up here in Little Rock, Arkansas. I ended up going to graduate school located in Louisville, Kentucky. Got my Master of Divinity in Pastoral Care and Counseling. I did a year-long residency at North Carolina Baptist Hospital in Pastoral Care and Counseling. Came back here to Little Rock area, ended up getting a Master's in Marriage and Family Therapy from Harding University there in Searcy. Early on, I recognized that I wanted to work with families. I wanted to work with individuals that were struggling and having challenges. For a while, I worked in a church setting. I recognized this as kind of my calling. As a licensed professional counselor, one of the things that we do is we work with individuals that are hurting, that are struggling. What I do is I do a psychosocial history when we first get started, just trying to understand kind of a person's background. We're not defined by our past, but we are impacted with it. As we're able to kind of work through that and better understand it, I think we're better able to move on from that and become something even better. So one of the things that I do is get a history, get an understanding of kind of how their family impacted them. When somebody comes to see me, I hope that they recognize that I understand that this is challenging and this is difficult to talk about some of our struggles and our difficulties and challenges. So one of the first things I try to do is help people feel comfortable, help them to feel at ease as best they can. I want to be someone that kind of walks alongside them as they work on identifying what needs to be different and how they can change. And so when a person first comes in, one of the things they can expect is I'm going to try to gain some understanding of what specifically have they been dealing with. Is this stuff from their family of origin? Is this something that they're struggling with now? I recognize that we can't change other people. All we can do is change ourselves. And so what I try to help people do is identify and recognize, what do I need to change about myself in order to get to a better place? I believe in the importance and recognition of meeting people where they are. I use a holistic perspective. So I look at what a person is doing to take care of themselves mentally, physically, spiritually, and socially. And so I recognize not everyone might have a faith-based, but we can use that in ways to better understand what the things they can do to improve themselves in each of those areas. And so I want people to feel comfortable bringing whatever struggle they might have, whether that's depression or anxiety or relationship challenges. We work with all those individuals. We want, again, people to feel like they can use us as a resource to help them get to a better place.